Discussion with colleagues in hospital, Part 1. What's going on in the department? Is there anything interesting going on in the ward? Have you had any interesting case in the ward now? I heard you had a possible case of acute pancreatitis in the ward. Where is the recently admitted patient, please? Don't you know in what ward is the patient with thyroidism who were admitted to clinic with chest pains yesterday? You admitted a new patient with hypertension and anemia, haven't you? When did your new patient enter here? Is the patient getting out of the ward soon? How many patients were admitted to your clinic a fortnight today with a history of neurotic syndrome? Where is the medical history of the patient from outpatient department? I wish to know his past history. Good morning, I'm Dr. Hu. I'd like to have a little talk with you. Come to the lounge with me so we can discuss this case. I'm taking care of this patient. I'm really worried about this patient. I'd like to go over this patient with you. Have you a chance to look over the patient? Fill me in on the story. Could you really tell me something about this patient? What made the patient refer to the clinic? I'll see the patient right away. Dr. Yu, had you tell me about your patient? It's a most interesting case, I think. I'd like to hear more details. Here a brief summary of her course up to now. When were these patients seen first? What diagnosis was suggested for her conditions? What were her complaints of recent admissions? Where was this 20-year-old patient complaints of on admissions? What symptoms did the patient develop before admission to our hospitals? What symptoms did you know in the patient on admissions? Did you make interactive findings on the physical? What picture did the patient present on physical examinations? Have you examined the 30-year-old patient with the tentative diagnosis of mitral valve prolapse? I'm interested in sarcoma. I'd like to hear more details of the case with episodic pain in the thigh. A 62-year-old woman was admitted to a hospital for evaluation of her morbid state of health. She was in good health until 4 days prior to admission. The patient denied previous hematemesis. The patient was very restless last night. Is the patient's calm or relaxed? Is the patient tense or relaxed? Does it seem like an attack? What's the etiology of her hypertension? What seemed to be the etiology of her disease? Dr. An, I would like to hear about hospitalization costs of the two patients you have treated lately. What's your opinion of the athenic pale woman in the ward? What's your impression of the case we admitted a week ago? I mean the girls with rheumatic carditis. The patient looks acutely ill. In regards to the physical, there's nothing special. The physical exam seems to substantiate my feeling. I found guarding at the physical exam. The rest of the physical exam is within normal limits. Did you hear Baron Trao on auscultations? Tell me please, what are his PB, respiration, pulse, and temperature? What exams did you order? I have ordered the routine studies. What are the lab results? Hematology is normal. Urinalysis is also normal. What is his white count? How many white cells are there on the CBC? He has a white count of 16,000 with 80% polished and a shift to the left is 25,000 with predominantly polished regions. Can you order X-ray of lumbar spine, pelvis, skull, and chest? How are the chest films? Chest film is clear. The film shows an abnormality of the hip joint. Did you control and Framstein the sputum? Have you run a blood culture after a tear? It would be wiser to make a tuberculosis test. They have to do a bone biopsy. They have to do a myogram. I would get cellular BPIs to gauges. I have to make a spinal tap. Thank you for watching.